Hi, everybody. Let's talk about the heart. So, what is your heart? Your heart is a muscle, it's a pump that distributes blood to the rest of the body. Before we talk about the blood flow, let's first talk about the anatomy, the structure of the heart. So, there are four different chambers, four different rooms of the heart, four little compartments. You have A, C, E, and G, and they stand for different things. A is known as the right atrium. This is known as the left atrium, the right ventricle, and the left ventricle. There are four different compartments. This, even though this looks like the left, this is really the right side because we're looking at it from the patient's view. So this is the right side and this is the left side. And again, the four chambers are right atrium, right ventricle, left atrium, left ventricle. Between these different rooms, just like a room in your house, you have doors, also known as valves. And the purpose, the function of a valve is similar to a door. It opens and closes to allow the blood to flow. So in those four valves, the valves are known as, so there's B, D, F, and H. B stands for the tricuspid valve. D stands for the pulmonary valve. F stands for the bicuspid or mitral valve. And finally, H stands for the aortic valve. So now we have our chambers and we have our valves. So let's focus on the atria. So atria is plural, atrium is singular. So let's focus on the atrium. If you notice, the walls of the atrium are thinner than the walls of the ventricles. That's because, just like if you think of your bicep, your muscle, if you work out your muscle, right, your muscle expands, it grows, it thickens. The more you work it out, the more it thickens. And the less you work it out, the less it thickens. So, the atria, as we will soon discuss, their function is simply just to push the blood to the ventricles. It's very easy. The blood doesn't have to go so far. Whereas the ventricles, let's take the right ventricle. The right ventricle has to pump the blood out to the lungs, back to the heart. We'll get to that shortly, but because it has to go somewhere else, not simply to the next point, it has to squeeze harder, and because it's squeezing harder, it builds up more muscles, quote unquote, and the wall is thicker. Whereas the left ventricle has to pump blood to the rest of the body. And it's even squeezing harder. So that's why the walls of the left ventricle are even thicker. But let's back up. Let's talk about blood flow. So, like we said, the heart pumps out blood to the rest of the body. Well, how does it do that? Blood enters into the heart through the inferior vena cava or the superior vena cava. Those are two veins. As we know, veins take blood to the heart and arteries take blood away from the heart. So you have these two veins bringing blood to the heart. And where do they put it? They put it into the right atrium. This is the first chamber where blood enters. So this right atrium fills up. Once it's full, the door, the tricuspid valve, R is for the right and L is for the left. So the tricuspid valve opens up and the blood rushes into the right ventricle. And then the tricuspid valve closes because we don't want the blood to backflow. So now the right ventricle is full. Well, where does the blood go then? It passes through the pulmonary valve into the lungs. So I don't have it here, but it goes to the lungs, and that's where the blood receives its oxygen. Then the blood comes back into the left atrium. The blood fills up, the door opens, the bicuspid valve opens, and the blood rushes into the left ventricle, and that's when the valve closes. Once the left ventricle is full, it squeezes really hard, and that's where this muscle comes in, right? This thick walls of the left ventricle, and it shoots out the blood past the aortic valve over here, into the aorta to the rest of the body. So now you understand why this wall of the left ventricle is thicker than, let's say, the right ventricle. Because the right ventricle, all that has to do is pump blood into the lungs. Whereas the left ventricle has to have enough force, has to squeeze hard enough to pump this blood out the aorta to the rest of the body. And this is how we have blood into, flowing to our brain, to our hands, to our toes, right? It's this heart, this pump that's squeezing. It's squeezing. And that's how our body has blood. Just a quick view of this diagram here. You have the 4 chambers. You have the valves. So 1 valve, 2, 3, 4. You have your blood flow. It goes like this. You have the divisions of the heart, right, which is 4 chambers. And then finally, the blood vessels, which are the inferior vena cava, superior vena cava, and the aorta. I hope this helps. Let me know if you have any questions.